We're on. Hey, everybody, and welcome to another edition of Salisbury 500, a periodic show where we talk with several people that I've met during my 50-year affiliation with Assumption College. And I know you're saying, there's no way that you're even 50 years old. But folks, the camera doesn't lie. Sometimes I do, but the camera doesn't lie. And I should say that this video is not sponsored by Assumption College. It's not sanctioned by Assumption College. In fact, Assumption College probably doesn't even know about it. But I want to ask you to do a big favor for me before we bring on Bob Dwyer, who's going to talk about a very timely topic of the day. Down in the bottom right-hand side of your screen, there's a little red button that says subscribe. If you'd be kind enough to hit that button, that would be greatly appreciated. And then there should be another button that has a little bell on it. Hit that as well. And then every time we have a new edition of Salisbury 500, you'll get it before the general public does. So with that being said, we want to thank you so much and welcome our guest, Bob Dwyer, to this segment. Bob, welcome.
Well, thank you, John. It's great to see you again. It's been a while.
You know, you're up in Maine. I'm in Worcester. But there's something going on that we both have in common, and that's that COVID-19 situation. I guess I could say that if you were anywhere in the world. You have an extensive background in serving the elderly. Can you tell us a little bit about that? And then I want to ask you some specific questions about the COVID-19 situation.
Sure. I've been working with older persons for 26 years before I retired and still am involved in it. I was the executive director of Central Mass Agency on Aging. Before that, I was their planner. Before that, I worked in adult day health centers. And currently, I am an adjunct professor at UMass Boston, teaching gerontology in the Masters of Aging Services program.
So you're certainly eminently qualified to answer some of the questions that I'm going to throw at you here. You've got to turn on a TV, you've got to pick up a newspaper, you've got to listen to the radio or go online and see any social media thing. And it appears that the elderly are the group that are being attacked by this situation, for lack of a better word. But how do you feel about this, being involved in that business?
Well, the first feeling, of course, is personal because I feel personally attacked by it. Not only am I considered an older American at this point, but I also have certain chronic diseases that put me at higher risk than others. But I think that what this does all around generally is point up to the fact that when you get older, you become more fragile generally.
Yep.
As it is. Now, fragile in different terms, different terminology. So I'm using it in a very general term at this point, because the fact is that anybody who is our age, and I'm putting you at my age, even though you're only 50.
Thank you very much, because I think, when did you get out? 75?
75, 76. Yeah, you're
75, 70,
just a
roughly around that time period. So thank you very much for giving me that 4-year grace period. I appreciate that.
You're very welcome.
Yeah.
But the fact is that as healthy as any of us may be, all of our innards are older. You know, so even though someone at 66 years old is healthy 66 years old, their lungs are still 66 years old. Their heart is still 66 years old, and all of their organs remain that age. So they have had dealt with the effects of aging.
So from a medical perspective, it's like a car with 200,000 miles.
Exactly. So
I don't know if that was a good analogy, but.
Well, it is a good analogy because you've got a car, you've got a couple 100,000 miles on it, still runs great. But you also know that at any point, you might have to put some money into it. You know, you might have to keep it going, or your brakes are going to go, or whatever. I mean, you know, that is a pretty good analogy.
Yeah. So when you look at the nursing home or assisted living facilities, and you hear the numbers of the fatalities that are being reported, the sad thing, I think, from a layman's perspective, is that none of these folks that are passing from this dreaded virus, they can't have any loved ones by their side during that time period where they possibly are ready for hospitalization.
That's absolutely true. But frankly, no one with the COVID-19, and especially in serious circumstances, can unless they're at home. And even at home, they recommend a particular type of isolation.
Mm-hmm.
But the fact is that in long-term care centers, nursing homes, rest homes, you are you have that feeling already of isolation, insulation, even if you do have visitors, because for the most part, that you don't have a visitor 24/7. You're always away from your loved ones, your friends, your family.
Mm-hmm. For those people that are in their 50s that have parents that are approaching the age where they generally become members of that assisted living community, what would you say to them? Is it still safe to have your parents and loved ones go to these types of facilities?
Um, that's a really good question, and I would say yes. I would say that it still is safe, um, because depending upon what the situation is for the individual older person, if they need that kind of uh, constant care, then it's probably still going to be safer at home. I know that many facilities, both in Massachusetts and Maine and throughout New England, are giving extra special attention by their local health departments in terms of providing personal protective gear, et cetera. Now they're all on some kind of alert as to people coming in. That doesn't mean that it's been 100%. I know of some cases that have hit my family personally, where someone was brought in and apparently did have COVID-19, and then the person known to my family is now in grave danger of dying in a hospital somewhere. So they caught it from someone who came in, another patient, another resident, as it were, who came into the facility with it.
Mm. Is this going to change the way facilities are run in the future with the number of residents that they can have, the way they serve them their meals, and more in the assisted places where people are somewhat independent? Is this going to be totally different from now on?
I would assume it's going to be, and it's going to be in two different ways. One is the daily operations are going to have to be much more sanitary. They're going to have to probably wear gloves and masks as they help these patients in assisted living or in a long-term care nursing center. But also, I believe that the level of preparedness is going to have to be upgraded. I think that the plans are going to have to be much more intricate. And I do believe that there's going to have to be some different kind of regulation as to how patients are moved from room to room. Right now, it's very stringent that a person cannot be changed, it cannot have a room changed in a nursing home, for example, without their permission and their family's permission. But I think in a situation such as this is going to have to be an escape clause, as it were, where if someone gets ill with a viral infection like this, that they should be able to be moved to a quarantine section.
Mm. Pretty sobering facts, and we're just about at the end of the time frame that we have allotted for this session. But as this progresses, I'm sure it's not going to end by the end of the week. Would you be able to come back with us and talk with us in further detail about this dreadful situation?
Anytime.
Great. Our guest has been Bob Dwyer. This is Salisbury 500. My name is John DePietro, and we want to wish you a great day.